on the vessel and you can actually blow the vein when you're trying to start the IV. This is the point where I'm going to go ahead and put on my gloves. Again, I try to wear the smallest gloves that I can so that I can feel a little better. So these are smalls, which fit pretty snugly. Now once I clean the vein, and so you're going to struggle with them a little bit just because they're pretty snug. This is where I want to go ahead and try to palpate the vein. I can feel it really well. Once I do this, I don't want to touch it anymore once I clean it. Now, I have to have the swab that I'm using. Sometimes in the facilities, you actually have the little ampules that you'll break in the middle and squeeze them so that the chlorhex comes down, but I don't. We happen to have swabs in the lab, so I'm not really certain what will be in your kits. It's a little difficult to open, so you kind of have to fight with them. You try really not to touch the pad a whole lot, though, because it's what you're cleaning the skin with. So I'm going to try to pick it up on the outside layer. And this is where you want to clean back and up and down and side to side for 15, I'm sorry, it used to be 15 seconds, but now actually they've increased it to 30 seconds. Now most of your patients aren't going to have the red on them because obviously this mannequin's been stuck several times. So we're going to make 30 seconds have gone by. That's why you want to look at your watches a lot of times, because 30 seconds is a really long time when you're sitting there scrubbing. Okay, it's been 30 seconds. You need to discard this so you can just lay it to the side. You're also going to notice that I have a barrier down. So on your patients, you want to do the same things because you're sticking the vein, you're going to get blood somewhere, and you really don't want to get on your linens or the patient's belongings and stuff. So, all right, I'm pretty much ready to go. I want to be sure that that completely dries before I start it. I don't want to fan it or anything like that because I know I'm just stirring around the microorganisms. So once it's completely dry, I again explain to the patient, okay, we're ready to start your IV. Any further questions? And he has none. Tubing's ready. Everything's laid out and ready to go. When I hold the cath on, now I'm left-handed, so it's not going to matter, but you'll notice I have my index finger. There's a little white button. That's the retracting button. That's so that I don't stick myself. So I want to hold it so that I can see the blood return come into the chamber here. I want to make sure that the bevel's up, which the bevel is up, because the bevel's going to be on the top part of that. I want to make sure that I secure the vein. Now, there's a lot of ways that I can do this. I'll generally pull down, because again, if I pull upward this way, I run the risk of contaminating my site as well as maybe sticking myself. So what I'll do is usually stabilize the vein. You're going to want to go in at about a 10 to 30 degree angle and pierce the skin bevel up. Once you pierce the skin, you want to immediately drop it, and you want to go a little further. I've got blood. I've got a blood return, so I'm going to go ever so slightly forward. This is where I stop. This hand does not move. I want to come up and I want to go ahead and release my tourniquet. My tourniquet is released. Now what I want to do is thread the cath line up to the hub, being careful to not touch what's about to go inside the patient because that's sterile. So I push this up. At this point, I can reach up. Now, I want to occlude the vein. These don't occlude well on the mannequins, but real individuals will do so. I want to compress up above where my cath line is pretty firmly. And I can usually come over and undo this one-handed, making sure I don't touch the end of that. Now, hold pressure firmly. Hit the little white button and retract your needle. And now I know they're bleeding, and that's fine. But when I do this, they stop. At this point, I let go. I want to reach up and touch on the blue part of the cath line, or pink or yellow, whatever color, green, whatever you're inserting, and hold it steady. This makes it a Luer-lock system. I want to slide this up, and I want to carefully secure. Notice that this hand is not twisting the cath line in the patient's vein. So I firmly do that, and now I'm good. I can hang on with one hand. This is where I want to go through. If I've got any blood on the skin, I want to clean it up so that the cath line sticks. Notice that I'm holding it very steadily and not moving. I want to go ahead before I tape it down. If I wanted to open it up and check to see, I could by just pulling and opening the chamber. This one happens to be pump tubing, and it's dripping, so I'm great. Just let it drip. Come over, pick up my op site, and carefully place it. Now this is a common mistake that we make. We don't want to cover this connection. We want to be able to undo it, but we want to protect this site and maintain sterility. So what I want to do is place it ever so slightly so that I catch that without catching the connection. There's always something like a little white piece on it. The white piece is going to come off, Now they tape a little better to real people than they do to the mannequin hands. At this point, it's secure. Now I just need to secure it with extra tape. If there's no blood or anything, I've cleaned it all up. I could take my gloves off, but I'm going to go ahead and try to show you how to do it with your gloves on, just to show that maybe it can be done. You've got a little tab. Tear that off. Now there's lots of different ways to tape IVs, but we're just going to go textbook for this moment. A lot of times what you want to do is you've got this connection and you don't want it moving around. So a lot of times what I'll do is try to not go over the op site, but just catch where I'm connected so that it can easily be removed. And when you use gloves, you're going to tape yourself to the patient just like so. Not a beautiful job because his hand's not pliable, but you could see that if I needed to remove this tape, I could, and without disrupting my IV site. And then generally what I'll do is another piece of tape or two, depending on how mobile the patient is, and go ahead and secure. This is where we would do an IV push at, so I don't really want to tape right there. And I usually try to stay away from taping over my op site, so there's lots of different ways to do this. I probably at this point, I've got something on my gloves, and on my tape, so I'm going to take that off. I'm just going to go ahead and take my gloves off because I don't want that on my patient. Properly take your gloves off inside out and continue to tape it, if you can see so. This is where I'm going to need my glasses. And I'm probably, on this patient with where it is, I'm probably going to just tape here. I may even come back and catch another piece of tape right here. Just want it secured so that when they move around, they're not going to lose their IV site. I'm going to just go ahead and put another piece of tape over here. It's not sticking well, but it'll stick a lot better to your patient's skin than it is to the mannequin. Alright, so the last thing I need to do is not to forget to label it, because I want to be sure that everybody knows exactly when I started it, so I would fill out this label with all the information that it asks for, and then I would place it. Generally people place it over the op site, but they make sure that they put it to where you can still completely see the entry site. So I'll put it right at the edge, but I don't want any more adhesive on the patient's skin than I need. So as you can look at this, it's completely on the op site. So we're visible, we've got it dated, we've got it secured, we make sure it's running at the proper rate, and we make sure the patient's, bed's back down, talk to him and everything, all the things that you know to do textbook-wise, and we're good to go. We just got to continually monitor it.